Hi, I'm Dr. Nicole Vane at Moonlight Beach Dental and wanted to go over a little bit about what makes our new patient exams different. In one of the last videos, I went over this patient's 3D cone beam, which is what brought her into the office. But even when we're using the normal checkup x-rays and following the normal process of a standard general dental office, there's a lot of things that were missed by the other dentist who she's been under the care of for about 10 years and loves the dentist. And when we take our x-rays, one, they're fully digital and they're low radiation, and they're also really optimized in contrast for us to see issues really easily. We also use a great intraoral camera as well as an extraoral camera to take some pictures that can really highlight the areas up close so patients can visually see what we're seeing as clinicians. And her concern was on a lot of levels: failing root canals, broken crowns, changes in her bite, and also some visible decay issues that she was noticing, but that the other dentist she just had a checkup last week said were just fine. So when we took our x-rays, the first thing I noticed was a lot of issues with the fit of the crowns and also issues with the root canals. Now, even on the basic view x-ray, which is two-dimensional, not three-dimensional, we can see that there's missed areas where the root canal isn't even filled in, where there was supposed to be a post space on several of the teeth. On this one, this is her newest crown she got from the other dentist. There is a big opening underneath where it's not sealed. This crown in the mouth is starting to turn black with bacteria. And also this tooth is root canal, and the entire canal space on the other x-rays is completely hollow. The dentist didn't even fill it in, which is concerning. I see that there's some broken crowns, some implant crowns that don't fit well up here. There was a big piece of tartar on this tooth that was just missed, even though their last exam and cleaning was 1 week ago. And then the other thing, when we took her through a tour, the patient was saying, I noticed these things, but my dentist said they were fine. And also images like this had never been shared with her. So let me just click through just a couple. One being that you can see right here, I mean, there's a big hole in this crown, two actually, and a lot of work was done on this to get the bite adjusted. I can see a lot of these things, and I love being able to show this to the patient. This was another tooth. This is a tooth that was fully worn through. The yellow is where they've worn off all the enamel, and it had broken here, here, and on another spot, and also had a failing filling, and the patient noticed it with her tongue, but was told that it looked okay. This is some of the other issues that we noticed. Big inflammatory collars around a lot of their crowns that show a metal reaction. I mean, this tissue from here all the way to here around all these teeth is super boggy and inflamed. And let me tell you, if you saw these areas and they were on your face and you were walking around with a huge swollen black eye with all this pooling of blood and inflammatory tissue, you would be really concerned if you just woke up with that. But you'd be even more concerned if it never went away and it just stayed like this for years and years. So these are some of the things that I like to look for. And then the other thing I noticed on the x-ray on the intraoral images, in addition to the x-ray, were again, some of these issues like at the gum line. Let me show you these two older crowns. These are the ones that I noticed that were broken. You can see how inflamed the tissue is here. You can see the decay here, in addition to all the porcelain that sheared off. And again, this tooth wasn't diagnosed with needing anything other than getting a watch on it from her existing dentist. This is the back side of the other crown that looks identical, again, broken here. Look at how inflamed this tissue is. And a lot of this is a metal reaction to the metals that are underneath, in addition to a bacterial reaction that's caused by all the decay and bacteria that's accumulating around these metals that the teeth don't really like. So this is what I like to call a full comprehensive exam. I want to take a look at everything structural on a new patient exam to really go through issues like metal reaction, gum and bone health issues, failing root canals, sinus issues, jaw pain issues, as well as layering in the other health issues that can be a result of having these long-term infections go on in your body. And we actually do this on every periodic exam as well. When you come in for your checkup exams, we take another tour of your mouth every time to see if anything's improved, gotten worse, or stayed the same. And I love this as a tool of education for our patients so that you can get the best information possible about what's going on in your mouth. And if you're interested in having an exam like this, feel free to come on in to Moonlight Beach Dental.